This is Dr. Scott Haggerty here with the Growing Healthy Families podcast. And today it is my distinct pleasure to be able to interview Dr. Seaman from dflame.com. How are you doing today, Dr. Seaman?
I'm doing good. How are you doing?
Doing wonderful.
Good.
So thanks so much for taking the time to be here with us today. We're very excited to have you on.
Thanks for having me.
Absolutely. So, ladies and gentlemen, I want to take a moment here to tell you why I was very excited about this interview, because this man and what he taught me literally saved my life. When I was in chiropractic school and I met Dr. Seaman, it was at the recommendation of one of my favorite instructors in chiropractic school, and he said it was a must-have course that I take his anti-inflammatory nutrition class. And at the time, I was dealing with a condition that is known as bronchiectasis, which is in the same family as COPD is. I had developed it 3 years prior when I was 29, and I spontaneously developed this nasty lung infection, which progressed into spitting up blood, and it became this chronic cough. And I had gone through every medical route there was. I'd been on antibiotics and inhaled corticosteroids and everything that was available, and it wasn't getting better. And finally, my pulmonologist had told me that at some point in time, I was going to have my left upper lobe of my lung cut out. And so my prognosis was pretty nasty, and I didn't look the part. I've always been an active guy. At the time when this all started, I was a bodybuilder. So externally, I looked like a person who was in optimal health, and internally, I was a wreck. And so when we took Dr. Seaman's class, I never expected that it was going to benefit me in the ways that it did. But when we took the first session of his anti-inflammatory class, we came home, my wife and I decided that we were going to clean out our house and go strict hardcore anti-inflammatory to see if when we got into practice, we could help other people to be able to apply this lifestyle to themselves. And so in the process, over the course of the month between sessions, I dropped 25 pounds. My wife dropped 15, which she's still mad at me for. And I was able to have this amazing thing happen. On Monday of the fourth week, there was a big change in my routine. Normally what would happen is I would get up and I would try to get out of the bedroom in the apartment as fast as I could to haul butt across the hall so I can get to the opposite side before I could start coughing, because I had this horrible cough every single morning. And that morning it didn't happen. I was able to get through my entire morning, getting my food ready for the school day, walking my dog outside, going to the gym, making it through my entire day at school, and it never returned. And I'll never forget walking into the module and seeing Dr. Seaman, and I come up to him and I said, Dr. Seaman, this is what happened, told him my story. And I said, is there any possibility that this anti-inflammatory nutrition could have helped my bronchiectasis? And he looked at me and he said, now you finally get it, don't you? And it hit me like a ton of bricks. Oh my gosh, it was profound and life-changing for me. So I thank you, sir. I thank you so much, because you gave me my life back.
That's great. So, so you didn't mention, I don't think that the bronchiectasis involves like hawking up and coughing up, like it feels like pounds of mucus, right?
Yeah, it's terrible.
Yeah, so that mucus just went away.
Yeah. It was the mucus, the blood, the cough, everything. I didn't have any urge. I mean, and it was terrible. I felt bad for the people who I was in class with, because they had to listen to me do that all day long.
God.
So yeah, it was terrible. 3 years.
So you think about it, really all you do is just basically eat this stuff here.
Yeah.
You got rid of sugar, flour, refined oils, and you replace all those calories with that stuff, and off you go. And you were young, so much more responsive. Someone who is in their 50s may not be so lucky if they've had it for years and years and years. But that stuff can kill you, as you got to have lungs removed.
Oh yeah.
Yeah.
So it was a very scary prognosis. So and so for those of you who are watching this, I want you to understand that there's a power in owning this kind of information, because regardless of diagnosis, right, we know that there is an ability of the body to heal if you put it in the right state, where we can see a lot of profound changes if you create that environment inside of the body. And so let me talk a little bit about you, Dr. Seaman, because I really think what you've done is amazing. So I want to tell our viewers a little bit more about you. So for those of you who are not familiar with Dr. Seaman, he's been studying chronic inflammation since 1987. In 2002, he wrote one of the first, if not the absolute first, scientific articles on the dietary induction of chronic inflammation. It's called the diet-induced pro-inflammatory state, a cause of chronic pain and other degenerative diseases, which was published in the Journal of Manipulative Physiotherapy in 2002. He has scientific papers about pain, inflammation, obesity, and nutrition, which have been cited by researchers at Harvard Medical School on 3 occasions, as well as many researchers at other universities in all across the United States, Canada, Brazil, Europe, Russia, the Middle East, Africa, India, China, and Australia. He has written books for the general public on the topics of inflammation. 2 books one called The Deflame Diet, and a second book called The Weight Loss Secrets You Need to Know. So you can follow him at his website, which is at www.deflame.com, which will also be in the show notes, as well as at Deflame Nutrition on Facebook and on YouTube, or you can follow him on Twitter at deflamedoc. All right. Did I get it all, Dr. Seaman?
You got it all.
All right. Wonderful. So first and foremost, I'd love everyone to know about your journey. So tell us about your background and your education and what led you to this point.
Well, when I got a bachelor's degree in biology with a concentration in nutrition from Rutgers University. And I went through the standard stuff that anyone goes through when they do a biology degree with whatever concentration you're going to be focusing on. And then I went to chiropractic college. And so my background, I really wish, I think when I was in school, I kind of wanted to get a degree in exercise physiology coupled with nutrition, but you can only do one. So my favorite course was actually an exercise physiology class. So what I liked about it so much was how the instructor made the physiology practical. And my nutrition stuff wasn't that practical. Like we starved different lots of chicks with different amino acids and looked how it started their growth, but it wasn't really practical or anything like that. And so when I was in chiropractic college, I used to watch students who needed to be adjusted regularly, and I'm thinking some of it was probably psychological, just because you have to get into it to get good at it and practice it and everything else. But there are people who actually had aches and pains that kind of just didn't go away. And so I wondered at that point what it was about people who didn't get better and why stuff kept hurting. And so I had it in my head. I thought nutrition played a role. And then I took a post-grad class after I graduated from chiropractic college from a British neuroscientist. And anyone who's been to chiro, college, med school, PT school, DO school, it doesn't really make any difference. It's basically a paper chase, just like the old, I think there was actually a TV show called Paper Chase. It was about, attorneys just like doing their paper chase. So when you're in school doing a paper chase, you don't really care. What you care most about is passing exams. You want to learn, but you have to pass exams. And so your mental focus is on memorizing whatever you have to memorize for the exam. And so this is my first time sitting in a neuroscience class after I had graduated where there was no need to worry about exams or anything. So I kind of sat back there and really looked and go, I don't remember that. I remember that. I remember that. I do remember this, that I remember. But this, he listed all the different chemicals that irritate the pain system. So there are specialized neurons that sense inflammation and injury, and those are called nociceptors. So they're basically nocere means to injure, so they're essentially injury receptors. Now they don't only turn on when they're injured; they turn on during normal stuff too, but just at a very, very low level, so there's no pain experience with it. But he listed all the various chemicals that irritate these nociceptors that would lead to pain, and I recognized at that point from my undergrad and then chiro school, and then I was working on a master's degree at that point. So I was bathed in those chemicals over many years of my science classes. Then I realized that those chemicals that irritate the pain system are directly related to, or 3/4 of them, directly related to what you eat. So I started going to the library, and this is the old days when that meant you had to get paper copies. So I filled up 8 to 10, I still have them actually, 8 to 10 4-door high, 2 feet at least deep filing cabinets with papers, probably 10,000 papers that I collected over the next, say, 5 years or so and beyond. So I spent every free moment I had at the library tracking down how food and supplements influence the release of those chemicals to see if we could sort of down regulate. Because the way pain works is you have to kind of like have this, there's like a threshold.
Mm-hmm.
So at this point of inflammatory chemistry, you may have no symptoms, no pain at all. Maybe here also, and then eventually no pain here. And all of a sudden at this level, you go a little higher and now you have pain. And
Mm-hmm.
so the misinterpretation is that nothing I did from here to here had any effect. It was just that last little bit.
Mm-hmm.
And that is how everyone to this day, for the most part, in any healthcare field is taught to view pain, because pain is still taught, unless you do a PhD or a master's type of program in pain. Pain is viewed from a very, very basic, unsophisticated physiological perspective, which was why you and others, just vegetables, how's that going to help me? Because we don't conceptualize the gradual increase in the inflammatory state that goes and goes, and then all of a sudden symptoms manifest, and we've been eating chicken fingers and fries and whatever else and donuts for 20, 30 years, and nothing has happened. So how could it be today the problem occurs? So the cause-effect relationship is very, very protracted, and it's not obvious because our brain picks up, immediate this caused that we can observe in short time, as opposed to very like, watch this, hands are gone.
Yep.
So we only can kind of like see cause effect when it's like this. When it's like this, our brains don't make that connection.
Yep.
And so when I was in that class, after whatever it was, from 82 to 78 to basically 88 or so, when I took those 10 years of being bathed in basic sciences with no really good clinical correlation. So that started me on the track. And so I started doing this with every patient who wasn't responding the way I wanted to. And next thing I knew, these aches and pains that they've had for years were gone.
That's awesome.
And some of the most profound ones were actually women in their mid-20s who were busy, walking around, doing sales jobs, in and out of the car, high heel stressing, not sleeping, not eating well, and they're young, and they were and their aches and pains and headaches and widespread pain and gut stuff were all diet induced. So when they made that change, of course they didn't believe it because of this.
Mm-hmm.
Like, well, I hurt, my life sucks, so I'll try it. And then next thing you know, they saw the cause and effect, because cause and effect, like say for you, was you did it and then you had to change. So you saw the cause and effect, but that's the treatment part.
Right.
The development, we don't see a connection.
Right.
So that struck me profoundly. And I was probably, I guess, that was 87, 88. Yeah. So that's over 30 years ago. So I've been in this thing for many, many years. It was only in 2016 that I wrote my Deflame diet book, just because I figured I had to get a book out there. The challenge for me, of course, is that you got to know the right people to really get like a book with a big publisher that sends it out there. And so that's the challenge. So when I listen to and watch and look at some of the books, I'm like, it's really just kind of shallow a little bit, because people think, well, all I got to do to fix my 30 years of eating donuts is take some fish oil. Well, good luck. It's not going to work.
Right.
Probably. Yeah. Yeah. That's a basic background, I think.
Well, and I appreciate you elaborating about that, because I think that a lot of people, don't necessarily have a context for that food inflammation relationship and that time buildup. And so, as we discussed, I work a lot with kids with neurodevelopmental challenges, and I have oftentimes a very similar conversation about the way that nerves can be sensitized. So, and I oftentimes will reference like teapots. And I use this analogy of, if you put two teapots on the stove at the same time, and both filled with the same amount of water, and you turn teapot 1 up to level 8, and you turn teapot 2 up to level 2, which one's going to boil first? And the analogy they get, that the nerve, the teapot is pretty close to the boiling point, and even if it doesn't boil there, you turn it up to 8.5, and it's going to start to boil, right? And I talk about that. The nerves work very much on this system where, if you get to that point where it's sitting close to level 8, then that little bit of stimulus is going to send it over the edge. And the goal then of everything that we try to accomplish, whether it's with adjusting or nutrition, is to try and take it from 8 to 7.5 to 7 to 6.5, which is exactly what you're describing. So I love the fact that you bring that type of a perspective to it, because I think it makes it very real that it's process based. And I think that's something that's oftentimes missed when it comes to that buildup of how foods create that systemic inflammation, but how it's a process, and then an ongoing process of bringing that process down using food for short term and long term.
Yeah, and the other thing too that people have a hard time connecting because of the cause effect nature of it being so protracted and long term is,
Mm.
so let's just say someone is 20 and basically lean, and then they're 35 and they're obese, and they've been obese or much more overweight than they would like to be for 5 years, and they didn't have any symptoms during those 5 years. And then year 36 of being obese for 10 years or overweight for 10 or 15 years, they say, well, I've been overweight for 10 or 15 years. How is that the problem? Because they don't realize that the same thing for obesity. The obesity process is actually a gradual inflaming process. And so what happens as your fat cells swell in size, because you don't get more fat cells, you just swell the size of the fat cells that you have. And so you got a blood supply in there too. And so what happens is, well, you understand what the word hypoxia means, which just means low amounts of oxygen. So from a practical perspective, you can look at it as all that fat kind of reducing the ability for the little blood vessels to deliver blood in and out of the fat mass. And so this hypoxic environment that you have to cross the threshold to, and it's different for everybody, that hypoxic environment is viewed by the immune system, because there's also an immune system inside your fat mass from when you're skinny to when you're obese. And when you're thin, the immune system's anti-inflammatory. And as actual fact, people hear about diabetes and like blood glucose levels and the term insulin sensitivity, meaning that your pancreas releases insulin and your muscles respond and glucose goes into your muscles. But when you're insulin resistant, your blood sugar is high and insulin levels are high. That whole process is part of this inflammatory state. So as this fat mass is developing, and we change from this anti-inflammatory lean state to this pro-inflammatory overfat state, the immune cells start to behave because of the hypoxia as if there is a low-grade infection. You don't get a fever, but the immune system turns on like there's a low-grade infection. And as those fat cells get bigger, one more thing, as those fat cells get bigger, because we're not supposed to be fat biologically, it's just imagine being obese and living in the jungle. You would just be like, taken down in a heartbeat by hyenas and lions and tigers and bears. Oh my, right? So you got to stay lean and quick and hide and run up the trees and all the rest of the stuff. So our bodies are not wired to just pack on a bunch of fat. And so once they do, and the fat mass becomes too much, the fat cells, each one as they go through their normal cell cycling, they become necrotic. We develop necrotic fat cells. And then so around these fat cells forms this crown of immune cells that are there to attack it, like the immune cells are going to attack an invading virus or bacteria.
Very interesting.
Yeah, and so when you hit that state, that's the crescendo. That's the ultimate terrible goal to reach. Once you reach that state, whether you eat or not, you feel like crap. And if you eat the same crap, you feel immediately worse after you eat it. And people still don't recognize that, because for 10, 30 years, or whatever it's been, 10, 20 years, there's been no symptomatic relationship. So they say, well, I guess I'm just old. My friends are like that. This is normal. And of course, that would be like saying that bronchiectasis is normal until a month later when you are bronchiectasis free. So this flaming up process, it involves acute inflammatory response after you pig out when you're young, with no untoward effects because you're still healthy. As your fat mass increases and you keep eating that way, symptoms start to pile on. Aches and pains, not as well rested, a little bit, fatiguey, some dips in depression, no longer as, perky as before. And you think, well, it's because I'm working, I'm stressed out. And that's true, because stress adds to the whole thing. But then 5 years later, you're a wreck. And now you're on multiple medications, and you got to deal with 3 or 4 kids and a sick spouse who's been doing it with you. So that's kind of a long-winded sort of way to kind of characterize what happens. And those people who achieve that, they're much more likely to have breast cancer. They're much more likely to give birth to an autistic child, a child who has any the broad spectrum of neurodevelopmental disorders that you're talking about. Much more likely to develop cancer, heart disease, diabetes. So basically, by the time people hit 40, they're already on 2 to 5 medications, and they're on it for life because they don't realize that they ate themselves into that state.
It's so interesting because clinically I see exactly the story that you're talking about here, and we actually call it the perfect storm.
Oh yeah,
So,
it's perfect word for it.
yeah, it very much is, because it's that pro-inflammatory state that has just caused so much harm internally, and just driven their body to a state of complete exhaustion, both physically and neurologically. So I love the way that you tied that all together.
So when you talk about the perfect storm, it's actually not a bad move to watch that movie, because you think, there's a little storm out there, no big deal,
Hmm.
because they didn't know the other ones were coming, right?
Hmm.
So
Yep.
you had the thing off the ocean, you had the nor'easter from wherever it was coming, you had something moving down and moving up, and then for 3 conversion, you got 80-foot waves. See, no one in their lives visualized the 80-foot waves crashing down upon them and making them miserable for the last half or third of their life, because you
Mhm.
don't see the waves coming. They're only 10-foot waves, no big deal. 20-foot waves, not a problem. 80-foot waves, dead.
Yep.
Yeah. And it comes on fast too, because
Yeah.
think about how fast that happened in that movie.
Yeah.
It hits, and now they're in it. Yeah.
Yeah, and that's oftentimes the thing. I think when we have the conversations here talking about the importance of really bringing the awareness to the pro-inflammatory state that we oftentimes create in ourselves, it's that people don't realize how far things have moved down the road, right? And then when they start expressing symptoms, so it's that leap that they have to make, that this was a process that I've driven down the road, now that I've got to invest in bringing back. And if the cells and the bodies and the physiology still has the ability to recover from it, then they have to really go all in. And there's not, it's not one of these things where you can go half in and dip your toe in. When you've gotten
Well,
to a
for
point
some
where you're
people,
expressing, huh?
for some people you can. For some people you can go
Right,
halfway. It
right.
depends upon, for you, because of your bronchiectasis, it required most likely, well, it required full in.
Yes, all in.
So the reason why I interrupted you is because a lot of people say, well, I could never not eat bread again. Well, you
Right.
you can.
Hmm.
You can have pizza. You can
Right.
have a donut. You just can't eat only pizza
Mhm.
and donuts.
Right.
And people will say, oh, my diet's pretty good. No, your diet really sucks. You go to the grocery store and stand there, and all you see are just sleds filled with packaged foods and breads
Mhm.
and sweets and all the rest of it.
Yep.
I'm really impressed with how few vegetables the average person gets. When I check out, they're like, is this a party? I'm like, no. What do you do with all this? Well, like say I guess it's a pound and a little more than a pound of broccoli. It's like 11 servings.
Hmm.
It's like 250 calories.
Hmm.
They go, well, that's a lot of broccoli. Well, just like one bag a night. You eat an entire bag? It's 250 calories. It's like nothing. 250 calories is basically, 2 donuts. People polish off 2 donuts in no time. You tell them to polish off a pound and a half of broccoli. It's like heavens to Murgatroyd. I can't do that. I can eat it in a week. Well, that's why you are living in misery, because you have that thought in your brain that you must basically exercise, right? You need to exercise your mind of those ridiculous thoughts, because when there were no donuts and when there were no French fries, we had to pack in the vegetation on top of whatever animals we would be eating. And that is what people need to get into their heads. And they just got to try it for a week. Now
Hmm.
you probably felt a little bit better after a week, but you still had all the hawking up.
Oh
People
yeah.
will feel better in a week if they do this.
Yep.
They may not be fixed within a week, and they may not ever be fixed completely if they've been really committed. Like, it's very, very difficult to eat yourself out of brain cancer or breast cancer or whatever, or pancreatic cancer. Some
Hmm.
can, but it's kind of like, once you cross that threshold, it's kind of hard to, like, it'd be kind of like, this perfect storm destroying your house. Well, at that point, you got to just build a new house.
Right.
So my suggestion for those listening is never get to that point, and immediately get rid of, like, if you look at the cover of my book, The Deflame Diet, on the top you have an image that looks like, where's my, there you go, the vegetables that you
Hmm.
see up there is on the top, and it's like a wave that's created, and this wave kind of washes down the front of the book and washes away bread, French fries, and cupcakes. And so you need to basically, the average person consumes about 60% of their calories, a little bit less, but that's a good round number to remember. 20% of the average American's calories every day comes from sugar. Another 20% comes from flour. Another 20% comes from the oils that you cook the sugar and flour in. So the average American is getting 60% of their calories from foods that didn't exist on Earth until the modern day. And so when you look at, sorry?
So I said that's a staggering amount of calories that the average person consumes.
Oh, it's mind-boggling. And so when people want to change, they go, well, should I try paleo? Should I try this? Should I do zone? Should I try vegan? Should I do plant? And all this other business. I say, well, think of it like this. If you go to the Arctic Circle before the flour and sugar arrived there, what did the people in the Arctic Circle eat? Well, for 9 months of the year, they're under snow. So they ate fatty land and sea animals. That's what they lived on, with no heart disease, no cancer. Because you'll typically hear breast cancer is caused by animal fat. Really? Well, then how come Eskimos, before the trading post showed up with their sugar, flour, and alcohol, how come they ate 80%, 70 to 80% of their calories from fat and no breast cancer?
Mm-hmm.
So fat's not doing it like that. You need to look at it properly, because you add sugar, flour, and the refined oils to animal fat. Well, then first of all, you exceed your caloric limit, and then you're loading up with foods that the body has never been exposed to. So you can be basically disease-free living an Eskimo diet. Let's just say you don't want to do that. Let's just say that you're Asian, you want to do the Okinawan plan. The Okinawan plan is a little bit of rice and a lot of the purple potatoes, vegetables, land and sea, and fish. You can do that, or you can go down to New Guinea and hang out with the Catawbans, and they eat mostly sweet potatoes that they grow. Sweet potatoes, taro roots, and yams, and then guavas and mangoes and papayas and pineapples. That's most of their calories. No diabetes, no heart disease. And so what's the commonality between the Eskimos and the people living in the Pacific South Seas? No sugar, no flour, no refined oils. So people have a wide option of foods to eat if they just dump away the refined sugars and flours and all the rest of the stuff. So no one should feel like, oh my God, my life's going to suck because I can't, eat whatever. You can eat anything you want. You can eat like an Eskimo. You can eat like a Viking. You can eat like, a Roman in the Mediterranean. You can eat like Aristotle used to eat. You can cruise over to India, eat like the Indians used to eat before rice became their main staple. You can go down to Vietnam, eat like the Vietnamese. You can go eat like the Koreans, the Chinese. It doesn't make any difference. The normal standard diet is one that is free of sugar, flour, and refined oils. Now, that being said, probably a couple hundred calories a day is no big deal. But they need to consume, like you lost weight without trying.
Right.
That's the thing that happens when you replace pro-inflammatory calories with vegetation, is that the vegetation calories take up like mass in your gut, you'll feel full, but they have, 20 to 50% less calories.
Yep.
And so that is the thing that people need to do.
And I'd like to comment on that, because one of the things I think that's interesting is that when we first really began implementing the protocols that you taught us and eating an anti-inflammatory lifestyle, what a lot of people ask me is, well, was I hungry? Well, I was actually eating more. Yeah. And that was interesting, because when we really started, implementing more of the, the plant, really, it was just getting rid of the grains and the refined foods, and, really bringing down the glycemic index of my diet, the sugar content of my diet. I was eating more and more often, and I was actually I was eating a lot. So I never had a moment where I really and truly felt hungry. I was actually very full, because I was a bodybuilder who ate 6 to 8 times per day. So I never had a moment where I felt like I was hungry or I was missing out. I actually felt very full, but my energy levels progressively got better. I was sleeping better. My workouts were better. My quality of life was better. Everything improved. And then there was the crossover point when my symptoms went away. And that's one of the really interesting things, is that, when you go through that process and you've been living with something that's a health struggle, and you start watching all of these things begin to change that you didn't realize were correlated with what you were putting in, it becomes very palpable, especially if you slip. Yeah. Because I had a time when I was traveling to Washington. I was on a lobbying trip, and it was a few months after I'd taken the course, and I'd been on a really great track. Diet was super tight, and I had to veer from my diet, because at that point in time, back in I guess it would have been 2009 in DC, there was not a lot of options. where we were eating, you didn't really have a lot of great choices. So I had some inflammatory foods. And the craziest thing happened. I got congested. I started to feel some of the effects returning.
Yeah.
And it didn't take long because obviously I was still not that far away. And a little bit of that stuff coming back in began to sensitize me. And I started to have some issues with the congestion and the mucus. And it became like, wow, I couldn't believe how quickly I can start to have return to some of the symptoms when I start introducing those foods consistently back into my diet. So I backed them right down, and amazingly enough, right back to normal. No more mucus, no lung congestion, no cough again.
Yeah, the way to look at that, because that's I several years ago, when I was working at wherever I was working, used to have lunch once in a while with this guy. And every time after we would eat, he goes, every time we eat here and I have those French fries, my arthritic hands just kind of kick in. I'm like, every time? He goes, I go, well, how many times? He goes, not 5. I go, so after you found out like the first time, maybe it was a fluke, you did it again the second time, how can you keep doing it? Why do you keep doing this to yourself? And it's very, very difficult for your brain that loves French fries to actually accept the fact that eating French fries for some people is an immediate symptom generator. Because you love French fries. I mean, who doesn't love French fries? I love sweet potato fries myself.
Delicious.
Amazing, right?
They are.
I love pizza too, but I'm not going to live on them. I have them once in a while. Just to get a taste. But if I get too many tastes, then the inner crackhead, the inner dietary crackhead kicks in and takes over.
Right.
And you do not want to let the crackhead out of the back room. You can feed it a little bit once in a while, but you bring none of that stuff home with you. So what happened to you in that moment was you had a robust immune response. And so the way to look at this is that we become essentially infected with pro-inflammatory calories, and the immune system reacts. And so people should realize that whenever you actually do get a real infection, the reason why you get symptoms is not just because the bug shows up. So I get a bug, say, someplace here. It's the immune system attacking that bug that gives you the symptoms. So when you down a bunch of fries and pizza and soda, your immune system is reacting as if you've been infected. And so that is the best way to look. We are infected by pro-inflammatory calories.
That's a great way to look at it. And I think that for anybody who, if you're listening to this, and this is something that you have that kind of an experience when you have inflammatory foods, right? Whether it's the pizza or it's the French fries, like your friend had. We talk a lot about when people will eat pizza. One of the things that I always ask them is, well, when you eat that pizza, how quickly afterwards you're starting to feel bloated? And that's one of the things we're like, well, I guess pretty much every time I have pizza, I feel bloated within a little bit. That's an inflammatory reaction that you're experiencing in your gut. Really? Yeah. And so we start talking about ways that they can experience pizza, using things like an almond flour or a cauliflower type pizza, something like that, and they can eat it and they won't have any of that same experience. And it's
when I eat that stuff, I have no reaction at all.
Yeah.
So my brain goes to me, have some more. You're fine. Eat some more.
Yeah.
That's what everybody's brain says.
Yeah.
And the average person who is listening to this, if they tend not to talk about that, because people are like, if you analyze your brain when it's around food, it's scary.
Yeah.
Pro-inflammatory foods make people, right? So no one wants to sit there and actually deal with. They're literally like a dietary crackhead. You can watch. I forget the comedian's name. What's his name? That funny dude who went to Africa for a while. What's his name? Dave Chappelle. On the Dave Chappelle show,
yes.
he plays this crackhead guy. That's how your brain works with dietary crack. And no one wants to sit there and just sit back and just, it's okay. Yes, it's like saying I'm an alcoholic. I'm a drug addict. And people say, well, I have a food addiction. Everybody does. The reason why we like donuts and breads and French fries and all those foods and pizza is because they actually do generate addiction biochemistry in your brain. And so everybody now somebody say, well, I'm addicted more to pretzels versus donuts. It's still flour. One is salted more, the other one is sugared more. But almost everybody overeats and wants to eat that stuff. So they have to deal with that mental. And that's where that second book I wrote is really, really beneficial, because the Weight Loss Secrets book, even if you're thin, the Weight Loss Secrets book teaches you how to watch your brain and to be respectful of all the input that we have, the primordial drives to eat, the physiological responses to food, the endless propaganda. Like I haven't had a TV in my house. I don't even know how long. When I go to hotels and travel, I don't even turn the TV on. The last time I did, maybe 3 years ago, I couldn't believe that it was just basically commercials were sugar, flour, refined oils in one commercial. And the next commercial was a drug to take because you ate the sugar, flour, and refined oils.
So true.
So I'm like,
So
what?
true.
This is really, because I hadn't watched television for like 5 years. I'm like, oh my God, this is getting way worse than it was 5 years ago when I had a TV. So my suggestion would be is just dump your television also, because it's not going to help you. It's just propaganda, head to toe, food, news, the whole thing. It's just a mess.
It really is. I agree. So Doc, I want to circle back around to something that you talked about before, because so many of the people that watch the podcast, and so many people that we care for in our practice here are moms. And I know that one of your passions is educating moms about breast health. And I would like for you to talk a little bit more, because I know you've mentioned that you've got an upcoming book that you're working on, and I know that this is something you're passionate about, is teaching moms about the role of this chronic systemic inflammation and what it can do towards causing issues with breast health. So can you elaborate on that for me, please?
Yeah. So it's interesting, actually, because I'm working on a book about depression too. And when I told somebody this, oh, I can't wait to read that book. And they know they had the other book, and the first book, The Deflamed Diet, is actually about depression. It's about breast health. It's about chronic pain. It's about avoiding cancer, because if you understand that inflammation is the foundation for all these conditions, but we are conditioned to think, okay, that word is my condition. I have to do this for that word, as opposed to understanding that inflammation is a thing that we should understand. Mm-hmm. So when it comes to breast health, if, let's say, a female is watching right now and her spouse or boyfriend is right there, and he might think, well, this is about breast health, it's not about prostate. Yeah, it is, because there is from a practical scientific purpose or perspective, there's no difference between prostate cancer and breast cancer. Mm-hmm. From a scientific research perspective, there are subtle nuances that makes them different biochemically, but the underlying driving force to it, it's identical. It's the overconsumption of those foods. It's achieving an obesity state and a diabetes state. So when you think about let's just say that we were to do exactly what you did when you were like right now, I'm assuming that you eat basically anti-inflammatory, and you eat at a caloric level that suits your needs. You do not gain any body fat, right? Okay.
Yes.
So let's just say that you said, hell with this. I'm going to go and I'm going to have 3 donuts a day for the next month. So you had 400 calories of basically sugar, flour, and refined oils. Those calories that you throw in there extra will, now it's a little bit difficult for the average person to visualize this, but I'll describe it to you, and then I'll reword it a little bit. So you think about Krebs cycle. Mm-hmm. versus glycolysis. Mm-hmm. So the way this works for the average person, so glycolysis would be like a line that takes sugar down to energy down here, and this circle called the Krebs cycle is able to create energy from glucose or sugar, but it's also able to create energy from fat and ketones. This line going down called glycolysis can only work on sugar. So when you overeat 400 calories of sugar, this is actually studied with human subjects. When you overeat about 400 calories worth of sugar on top of your standard diet that's anti-inflammatory, what happens is the Krebs cycle over here kind of like quiets down, and you start to facilitate more of this sugar pathway. So cancer, what happens for a cancer cell to become a cancer cell, that Krebs cycle, which is taking place in mitochondria, which a lot of people hear about mitochondria. So if you were to envision a cell, my nose would be the nucleus and my eyeballs would be these things called mitochondria. And the mitochondria is where energy is produced. So when you overeat sugar, like I just described, it basically kind of depresses and puts to sleep the mitochondria. Now, why this is just, if you were to do this starting tomorrow for a month, you would depress your mitochondrial function and you would more facilitate glycolysis. Now, the reason why this is important is because a cancer cell has a fully depressed mitochondria that's no longer working. Yeah. And so the way we get energy then is purely through this glycolysis line, as opposed to the circle. So the line takes place in the middle of the cell, and the circle, the Krebs cycle, takes place in the mitochondria. If you put the mitochondria to sleep, you're only going to be making energy from sugar. So doing that to yourself mimics a cancer environment in a cancer cell.
Very interesting.
Yeah. Now, it's not going to give you cancer in that moment, but it mimics it.
Mm-hmm.
So when cancer emerges, the only way cancer can emerge, because what happens is cells go through their cycling.
Mm-hmm.
So a good example of this would be, so I'm going to guess a handful of your patients, I'm going to guess maybe 5-10% of your patients who are older females are probably taking Fosamax or one of those medications for bone health.
A handful, yeah.
Yeah. So what Fosamax does is it stops a certain cell from degrading bone. It's called an osteoclast. It digests bone.
Mm-hmm.
So we need osteoclast because as we move and we chew, our bone that is in my jaw today was not the same bone that was in my jaw last year or the year before. So your cells recycle. And this recycling process is normal. And it's very, very well timed. And it's only well timed when you have no sugar, no flour, no refined oils, and you're not overeating calories. So when you take away the mitochondria, what mitochondria are no longer able to. Actually, I'll get back to the Fosamax. The Fosamax blocks the osteoclast from working, and so you don't get recycling. And so what some people get is osteonecrosis of the jawbone due to lack of proper cell cycling. So when you make your mitochondria go to sleep, what happens now is that cells that should die and get replaced with new healthy cells live on. They become immortalized. So gaining weight, overeating sugar and flour, slowly but surely creates the environment for your mitochondria to shut down, no longer, because the mitochondria, what they do, their job is to sense when the cell's old and needs to go, and the mitochondria creates this pore inside of it and then the cell wall, and the cell dies.
Mm-hmm.
And immune cells come over, gobble it up, and you get a new one. Mm-hmm. So cancer cells are the cells that don't die because the mitochondria are sleeping because of our lifestyle. And now these cells are said to become immortalized. And they live on and they don't stop. And the problem with that is that for that to take place, it's a 10, 20-year cycle where the entire body morphs into this pro-inflammatory state, which is why, unfortunately, there is no cure for any disease. Like you cannot cure cancer by taking a pill. Because what happens is you have multiple overlapping, sequential, sharing loop cycles that basically change and become cancer drivers. So you just can't drink a bottle of smart water and fix your Alzheimer's disease, because Alzheimer's is basically a cancer-like state, but not the same chemistry. Alzheimer's chemistry is no different than cancer chemistry. It just kills you differently. Heart disease chemistry is identical from a practical perspective to Alzheimer's and cancer. So anyone who wants to avoid cancer, and if they already have cancer, you need to absolutely get rid of sugar, flour, and refined oil calories. Now, do you think that was too complicated, or did I do it okay where it can make some sense, you think?
I think that it was very palatable, because
okay.
I'm sitting here listening to this and trying to put myself in the position of someone who's never heard this before. And I think I think it's, if you're listening to this, I think this is some real gold in what he just said, because what he was talking about is that everything is this long-term process of buildup that is driven by this pro-inflammatory state, and it doesn't matter what the label or the diagnosis becomes. It's an environment that was created in your body over a long term. It builds up and breaks you down until your body, whether it's the heart or the brain, whether it's Alzheimer's, no matter what the label becomes, it's the body's inability to adapt to that pro-inflammatory state that goes over the edge. It becomes a label or a diagnosis. Is that a good summary?
Yes, a really good summary. And the problem is, like, say for breast cancer, because there are a lot of women who develop, because you have premenopausal and postmenopausal breast cancer, and
Mhm.
they're a little bit different, of course. But you think about postmenopausal, you had to be a lot. Now you're like over 50, right?
Mhm.
And or maybe even earlier, but you've been flaming for years.
Mhm.
And so to get it when you're younger, it's a little bit more complicated, but it still involves the flame turning on.
Right.
So the thing to do is for uh, the mother, because in most cases, in the average office, unless you have a sports office where you're dealing with, like, just male athletic teams, the average chiropractic, physical therapy, or medical doctor office is like 60 to 70% women.
Mhm.
And the reason why is because women are like, how do you feel? Feel like crap. I got to do something. Guys are like, how do you feel? Feel like crap. My friends do. It's normal. Who cares? And so you know what it's like, sir. A guy comes into the office, sir. Why are you here? My wife made me come in. Now
So
you're
true.
laughing like that because that's exactly what they say. Is there anything wrong with you? I'm fine. You're on 6 medications. Besides that, I'm fine. You're obese. Yeah. Besides that, I'm good. You got a diabetic foot. Yeah. Besides that, I'm fine. See, guys really kind of like suck at that because they got to be guys.
Yep.
So the
Very
thing to
true.
do is for the mother, because still in most cases, the mom shops.
Yep.
She should clean that house out, make it an absolutely deflame zone. And the only time that anybody goes out and eats crap is when they go out and they buy it and they eat it out the house and keep the outside the house and keep the house pure, like the first
Mhm.
movie Poltergeist. This house is pure. Remember that? You're too young. Remember Poltergeist?
Oh,
This
I
house is
remember
not.
guys.
Yeah,
Yes. This
yeah. You
house
want to
is
have the house. What's that?
clear. She says, "This house is clear."
This house is clear. Yeah, yeah. So that's what you want to do to your house. You want to make
Mhm.
your house
Yep.
pure,
Yep.
pure.
It's very much what
And
we did.
yeah, and that's it. Otherwise, the dietary crackhead will eat
Yep.
if it's
Well, and
there.
I really I appreciate what you said there because I think it's super important to realize that cleaning the environment out is a really crucial part of the game. Because if you have it, we're all weak, right? If you have pro-inflammatory foods,
Absolutely. Just real quick,
yeah,
that's really important. See, and this is a bit difficult. See, for a big tough guy like you are crushed by bronchiectasis,
hmm,
right?
yeah,
Yeah. So when you get crushed, you can get more in touch with the fact of like how fragile you are.
yeah,
And so it's really important for your listeners, your patients, and if they share this with people, to particularly for the guys like her, to realize that they are weak. Just the biggest, bulkiest guy, like the Arnold Schwarzenegger guy versus the little guy on the beach, still weak when
yeah,
it comes to food.
yep.
Still have to battle the same thing. And so if we acknowledge that we are weak, which is what I am around those foods, because they influence your brain no differently than a recreational drug. And so
That's
you
very
have to keep your house clean of those foods because if I ever did take a hit of crack, I'm a crackhead.
yep.
And most parents will remember, if they think about it, the first time they gave their kid. I mean, let's just say, because some people don't give their kids any crap at all until they're 5 or 2 or whatever it is. And
Hmm.
the first hit of dietary crack, you can see this emotional reaction occur within the child because it was a totally new sensorial experience. And what do they want? They want that experience again.
Hmm.
And that is a real problem.
That's
And
huge.
and food scientists, what they do is they design these foods where you never feel satiation from these foods. I learned this about Doritos. I'm like, how can you have like 100 different ingredients? Because if you eat Doritos, you never get tired of eating them.
I
I mean,
know.
think about that, right?
I was a fat little kid who used to pound out a large bag of Doritos in a single serving, so I know what that's like. I was
You-
perfect example.
So for you, that's so you're a fat kid
Oh
who
yeah,
had who's living in a secondary smoke environment.
yeah,
So you had a double hit. You had the obesity thing when you were young, plus being blasted by cigarette smoke for however long it was. So you were pre-flamed. So even though you started to exercise and got fit, you were still living in that pre-flame state, and it took you to go through the deflame to basically cure yourself.
Yep.
Yeah.
Absolutely.
So that
I very much I resonate with that, because I actually had a conversation this morning, and so for our listeners, if you're not familiar with if you're watching this for the first time, you don't know who I am. I'm a pediatric and neurodevelopmental chiropractor, and so I work with a lot of kids who have really difficult stuff. And so one of the consults I was doing this morning, I was actually talking to a mom about a little boy who has overlapping diagnoses of anxiety, stress, focus and attention issues, coupled with autoimmune issues, coupled with severe constipation, congestion. I mean, you literally name anything that you could put on a review of systems, and he had it. And so, we start talking a little bit about some of his basics and his nutrition. And she says that his only drinks right now are, he drinks Gatorade or Powerade. Or he'll drink juice, and he'll have a Pediasure, which is his like healthiest thing that he eats. So, and the vast majority of the foods that he consumes were all, processed foods, high glycemic index foods, very, very little that was going to bring down the systemic inflammation. And this is a kid who has not pooped on his own in his entire life.
How old is he?
He's 6.
Oh my God.
6. And it's things like this when we start looking at it from the many angles, right? And in chiropractic, if you guys aren't familiar with chiropractic, we use this triad of health: chemical, physical, and emotional health. And anytime that triad, that triangle, gets out of balance in some way, shape, or form, is going to affect your health. In this case here, this kid had, again, a perfect storm of things with so many processes that had gone bad, that looking at how we're going to rebuild his health and his immune system and his nervous system, it's got to be multifaceted, multi-pronged. One of the biggest prongs being is that we've got to get his diet right to get him in a state where we can bring down inflammation, so his gut, his immune system, his nervous system, everything can get into a state where it's going to heal and respond. Otherwise, we're fighting an uphill battle that's darn near impossible. Wouldn't you agree?
Absolutely. And the problem with kids too, once you give a kid a hit of dietary crack. So when I grew up, I was born in 1960. If I had like less gray hair, I might even look younger. I don't know. But I was born in 1960, and whatever the parents said was basically law. Now kids have dial up to social services in case no dessert. Well, this is not fair. So there's a real problem now with how kids really run the house.
Right.
I remember growing up and seeing just once in a blue moon a kid who basically ruled the roost, and it was a nightmare. I mean, it was an absolute nightmare, temper tantrum, just maniac. And so that is really, really, kind of what we have now in many respects with kids. And so a lot of parents say, well, my child just won't eat that stuff. Well, I will tell you this much: if you clean your house out and make it healthy, and learn how to make, the healthy stuff taste good, there is a point when the kid will do temper tantrum, everything else, and go on, but then they will relent.
Yep.
Because what will happen is that their survival mechanism will kick in. And in fact, if they are, holding their breath and they're not eating, well, they're not going to like suffocate themselves. So you can not worry about that. And they're going to eat. And then when they do eat, these foods here that they said they hated, when they haven't eaten for a couple days, all of a sudden cabbage is going to taste awesome. And that's where you want to go, and then get that habituated into the child's brain and the husband and the wife. And then the whole house is focusing their calories on vegetation. Now, one of the things people say, well, that's so expensive. Now you can go to Aldi. You have Aldi's up by you?
Yeah. Aldi's and Costco's. And
yeah, you can get vegetation on the cheap.
Yep.
You can get really, and then people say, well, what's better, fresh or frozen? Well, let's see. Now you're eating French fries and donuts. Frozen or fresh is just fine. Here's what people do. One of the barriers that people encounter when they want to change, they're like, well, I need a recipe plan to like change. Really? Well, when I went to college and I left my parents' recipe plan, I was on my own, right? And it didn't take long to see, the freshmen 10 or 15 or whatever it is, guys, gals packing on. No one had to like get in line. Listen, I'd like to become obese. I need a plan, right? So if you need a plan to become obese, how come all of a sudden to eat vegetables you need a plan? You eat exactly the way you do. You just get rid of sugar and flour. Why need a recipe book? Well, what's your favorite? What if I was to ask you, what is your favorite ethnic food that you could cook at home? Like as I'm saying, don't go Thai food unless you know how to do Thai, right?
I
So
love Lebanese food.
Lebanese.
Love
Okay.
Lebanese food.
Okay. So that's a little bit more difficult for the average person because they're like, well, what the hell is that? So let's do Italian.
Mm.
Okay, Italian.
I'm married to an Italian woman, so that's perfect.
There you go. Okay. So, but a lot of people say Italian. So you think, okay, well, if you visualize Italian, you're visualizing meatballs on spaghetti.
Mm-hmm.
Well, now just go and get a spiralizer and spiralize zucchini and replace the pasta with zucchini.
Mm-hmm.
And now you don't need a recipe book. You just need to replace your sugar and flour calories with vegetation. And that's all one needs to do. So what kind of recipe book should I have? Well, if you like Greek, Italian, Asian, go get a recipe book, follow the recipes. But whenever it asks for something floury, you put vegetation in there, like pizza made with a cauliflower crust.
Yeah.
So now you have a little bit of cheese, more vegetables on vegetables with sauce vegetables. And all of a sudden, pizza that's pro-inflammatory, filled with gluten and flour, is now way anti-inflammatory.
Yep.
And so people tend to think that they can't eat healthy unless they have a total plan. But again, for those listening, if you've been eating poorly, no one gave you the playbook to eat poorly. You did it on your own.
Yep. You know, one of the great things I really love about what you teach is that it gives a framework. And the importance of frameworks is it's not a diet, quote unquote. It's an understanding of what should be consumed to optimize my health. And so, you know, once you kind of have a context of what it really means to go and eat an anti-inflammatory lifestyle, it gives you then a freedom to then start building things into your diet and your eating regimen that stay within a framework that keep moving the needle in the right direction. And so that's what I really like is the fact that on your website, there's a lot of great resources for people to understand what pro-inflammatory foods are, but from the books and the other resources you have on the website. And for those of you who are interested, I would encourage you to buy the book. I think it's a fantastic resource because I've had the privilege of learning this directly from Dr. Seaman, and the material in it's gold. Because once you can own what it means, then you can apply it very easily in your life, and you can make better choices in your home, at the grocery store, when you go out to eat. Because now you can look at food and you can look at it from a different window, not just taste, but you can also understand effect. And when you see the real profound health changes that you can see in your own life, then it makes it very real. And many of the families that I've worked with here, because one of the things that I've always encouraged everyone to do is to understand that health is a process always. And when you look at getting sick or getting healthy, it's a process that you have to take the body down that road of making lifestyle choices that create a pro-health state or a pro-sickness state. And so learning how to go and eat healthier and to bring down systemic inflammation is a process of learning how to implement it into your lifestyle. Would you agree?
Mm-hmm. Yeah.
One thing I want to circle back on, which I think is something that is becoming especially in our day and age, is a bigger issue than what I think it should be, is a lot of people try and supplement their way to good health instead of eating well. And I would like to hear your opinion on the use of supplements versus foods in an average person's diet.
I think it's really foolish to you cannot supplement yourself out of a deficiency except for vitamin D.
Mm-hmm.
And well, you can to some degree, but you cannot supplement yourself into a healthy state.
Mm-hmm.
And so supplements, it's actually very interesting. If you look at studies that they do with laboratory animals, or even with humans, and what they'll say, well, there's a 30% improvement if you took this supplement, but they have to realize that the statistics that they're referring to are not the statistics that you think that they're referring to. So really, when you see there's an improvement, it's a statistically significant improvement in most cases. Now, that means, let's just say, for example, you were to take vitamin D, or let's do some other the new magical CBD. CBD is the new magical supplement. You take CBD oil and you go from a depression level of say 15 on a scale down to 12. Well, if the cutoff for depression is 10, you're still depressed.
Mm-hmm.
And so people don't realize that. And when you look at people who say this supplement did this amazing difference, and you look at it and they blow up the chart and it went from 16 to 14. It's irrelevant. It's irrelevant clinically. It's relevant statistically. And in most cases, trying to supplement yourself into a healthy state is, it's kind of a waste of time. I'm not saying it's not going to give some benefit, but it will not get you. You could have never supplemented yourself out of bronchiectasis.
Amen.
Yeah.
Amen.
And so you would be the perfect example of this. So someone who has osteoarthritis, what can I take? Now, osteoarthritis is a good example because that osteoarthritis is a condition for which glucosamine was first used, 30 years ago or so. And it became very, very popular. And people who are still in practice today, oh, yeah, I remember that. I go, do you use it anymore? Nah, it didn't work. So I will tell you what's very interesting is that the most recent studies, when they talk about the marker for improvement by taking just glucosamine or chondroitin without doing any supplemental change, is basically a 20% reduction in symptoms. So if you come into my office and you're at a 5 out of 10 with pain, and I give you glucosamine, you go to a 4 out of 10, you're still like, yeah, it still kind of hurts. That right there was a massive success. But you're not going to go from a 5 to a 1 or a 0 by just taking glucosamine.
Amen.
So I think those supplements should be taken. Like I think that everyone should at least take, for the most part, there are probably some outliers, but really magnesium, fish oil, vitamin D. Those three have the most broad spectrum physiological anti-inflammatory, health promoting, vitality promoting physiologic effects. So those three are inexpensive also. So if you get rid of junk and you eat more vegetation and take those three, the effects of eating better will be augmented. But if you don't eat better and just take those three, probably not so much.
Amen. That's gold there. So Dr. Seaman, I really appreciate your time. This has been wonderful. I thank you so much for spending some time with us. And so I'm going to throw this out there now. I'm going to bet the listeners would love to have you back at some point. Will we be able to get you back on here again?
Sure. Why don't we wait and see if they have some questions and stuff, and then we'll kind of address issues because everyone listening and everyone in med school and chiro school and DO school, everyone is trained to think of, I've got depression. How do I treat it? And so the questions still come up. What do I take for this? How do I eat for that? What do I do for this? And we need to exercise them out of that mentality, which I had too at one point. And then it takes more than one shot. So let them, communicate with you, and then we can, we can run through it again.
That'll be great. So Dr. Seaman, what would be your recommendations for action steps for people that want to learn more about what you teach?
If you wanted something free, you can just go to Deflame Nutrition. I got like 30 or 40 videos on there. Click all the videos and then look down and see what makes sense. Like the first one I did 2 years ago was called the Deflame Diet Basics. And that shows you how these flamey foods kind of kick in and screw things up. And so that would be, the easiest thing to watch if they want a lot of details. Then, the Deflame diet is really not very expensive. It's like $24.95 for the paperback, and it's like $9.99 for the Kindle. And the weight loss book, which is really a book about a mental state that one must adopt to eat well, is 99 cents Kindle.
Wow.
So it's practically free, right? It's practically free. I mean, 99 cents these days is free.
Yes.
Yeah. Otherwise, it's $12.95 for the paperback book. I would recommend reading those and then thinking about what's in the books along with what's in this video. And then if they communicate with you, we can go deeper into this as opposed to maybe, if we could go deeper in, we can go a lot farther and help people more.
Love it. Fantastic. And so for those of you who are watching, thank you very much for viewing this episode today. And make sure that you send us questions, because the goal with all of this is to make sure that you and your family can get real tangible health benefits and change from this episode. And make sure that you go and visit deflame.com. So buy his books. They're absolute pure gold in there. I would recommend them to anybody. And send us questions, because boy, we want to keep this going, and we want to start really driving the wheel in both the Cleveland area where we are and everybody who's watching this, so that you can get the tools and strategies necessary to grow yourself a healthy family. God bless you guys. Be elite.
Thanks for having me.
Thanks for being there.